Hi, I'm Dr. Howard Zucker with a Docology diagnosis. The headline: the Centers for Disease Control is pulling back more than $11 billion in funding for states to conduct pandemic research and prevention. The Department of Health and Human Services explanation: well, those funds were earmarked for COVID-19, and since the pandemic is over, there's an opportunity to save money. I get the principle, but here's my view of the impact. Having served at the CDC as Deputy Director for Global Health under President Biden, and also as a State Health Commissioner during the pandemic. One, those funds were being used for general pandemic research and readiness in addition to COVID-19, so that we're better prepared for the next outbreak, whether it's COVID-19 or something completely different. Number two, COVID still kills hundreds of people per week in this country, and the long-term effects of COVID, which can be severe, are still being studied. And three, the funds were also being used to fund COVID testing, vaccination, and health disparities among high-risk and underserved populations. My diagnosis: concerning. Now here's why. The Secretary of Health and Human Services, Robert F. Kennedy Jr., says these cuts are meant to prioritize making America healthy again, which we're all in favor of. Making the country healthy is a great objective. But he has not explained how slashing the pandemic preparedness does that. On the surface, it would seem to do the opposite. Now, maybe there is a plan, and if so, he should share it with the country, a country more at risk from a pandemic now than has ever been. And that's our Docology diagnosis. Subscribe at the link below so that you can ask me anything, and join our full podcast episodes on YouTube and Substack.